All right, awesome. We are here tonight to share more about what cesarean birth looks like and to have an understanding of maybe why that might be a choice for you and what to expect for that, or if you're trying to avoid cesarean and just want to feel prepared in case that is your journey. We're going to talk about the whys, and hows and what to expect for cesarean birth tonight. If you have not met me before, my name is Allison Rollins, and as a doula, I have the privilege of supporting families who go through that transformative experience of pregnancy and birth and those early weeks postpartum. And as with any transformation, the decision that we make, each are unique and individual based on what we feel is right for us. So that's really important. So I hope everybody's ready to get started. I am super excited about this. Awesome. Caitlin, you're also in March. Oh, that's amazing. All these ladies are due in March. Fantastic. Well, if you're delivering in the same hospital, maybe you'll see each other. Sometimes that happens. Somebody goes late, the other person goes early, and that's wonderful. So what I'm going to do now is share my screen. So let me go in here, make sure I know how to do this right. Share screen. And here, screen. And then I'm going to pull up and get us started. All right. So welcome again. We may have others joining us tonight, but we're going to go ahead and get started. If you have questions, type those into the chat bar. And as we end, we'll go ahead and review any of those. I did have one mom who sent me some questions ahead of time, so I'm going to go ahead and answer those as we go through or towards the end. But again, tonight is about feeling more comfortable and understanding what to expect with cesarean birth and the what's, whys, and hows for cesarean birth and what to expect. So to get us started, when many expectant parents envision birth, the birth of their baby, the images that come to mind are as varied and individual as they are individual. So for some, an unmedicated vaginal birth is what comes to mind when you think about your imagining your goals for your birth. Others, it's cesarean birth. So today we're going to take a look at what is cesarean birth and why a cesarean birth may be done and what to expect if and when your baby is born via cesarean. Awesome. The term cesarean birth is thought to have been named after Julius Caesar. It was a word that was thought to be coined after the way that Caesar was born. However, there's some debate among historians about the fact if he was actually born that way. A cesarean birth or cesarean section is the process of delivering through the incision in the birthing parent's abdomen or uterus. So a cesarean birth is an abdominal surgery and is commonly referred to as a C-section or a cesarean delivery. Once baby has been delivered through the abdomen, the uterus and the abdominal wall are closed using sutures or staples. The exact type of suture or how the abdomen is closed varies from doctor to doctor. So we're going to take a look at the common reasons of why cesarean birth is necessary. Medically, so cesarean birth may happen for lots of different reasons. A medical reason may present itself before or after or during birth, during labor to make cesarean birth the safest choice for you and your baby. Or perhaps the birthing parent has a preference for cesarean birth for personal reasons. So let's take a look at some of the common indications for cesarean birth. Medical indications for cesarean birth types typically fall in two categories: before labor begins and after labor has begun. I'm sure you ladies have heard stories of friends who have had scheduled cesareans, and those have friends who have also ended up with a cesarean because labor just didn't go the way that baby and mom needed it to. So consumer choice or cesarean on demand is a term used when you choose to have a cesarean without medical indication. And this includes having a preference for cesarean birth with a first birth or possibly a previous vaginal or cesarean birth. There are several indications, and needless to say, many things influence one's decision on choosing cesarean birth. Oops, I think I went the wrong way. There. For some parents, there will be medical reasons that indicate cesarean birth. It may be safer for you, for mom and baby. These reasons may be clear before labor begins, and for others, they may surface during the course of labor, as we said before. Some of the reasons for cesarean birth before labor begins include multiple gestations, so twins or multiples, active herpes outbreak, maternal HIV, severe hypertension or preeclampsia, so that's blood pressure issues, the baby's position, previous cesarean birth, or placenta previa. So we're going to review all of these. All right, so multiple gestation, one or more common medical indications for cesarean birth is multiple gestations. And while it is possible for babies to be born vaginally, actually, I am a twin, so we were born vaginally, and you may have heard of other moms who have had twins who were born vaginally. So this is a choice between doctor and health of the baby, and also the position of those twins. In multiple pregnancies, the position of babies can be medical indicator. So if either of the babies may be breech or at a not so optimal position, then they worry about proceeding with vaginal birth. Anybody here know anyone who's had twins vaginally or cesarean? You can write that into the chat bar. All right. Sorry, getting lost here. Some providers will require that both babies be head down with a twin pregnancy in order to consider vaginal birth. Other positions, there could be the possibility of what's called a cord prolapse, or the baby's bodies may become entangled during labor or during the vaginal birth, creating cesarean situation. With higher order multiples, triplets, quads, most providers are just not comfortable with the potential risk of delivery. So most of those babies are born via cesarean. It is best to have a discussion about this with your OB care provider. And if you're carrying multiples and desire a vaginal birth, definitely talk with them early on. Awesome. So the other one is active herpes outbreak. Genital herpes, also known as HSV, is a sexually transmitted infection. There are two strains of the HSV virus. The first causes sores on the genitals and is referred to as HSV2. The second primarily causes cold sores or fever blisters of the lips, mouth, and is known as HSV1. While it is possible for HSV1 to infect the genital area, the vast majority of genital herpes outbreaks are caused by the HSV2 virus. When HSV2 is active, just before or during the time of birth, there is a risk of the infant contracting herpes. This risk is increased when active sores are present, and when a newborn contracts this virus, it may cause illness or death. Called neonatal herpes, the infection can cause mental retardation, nervous system damage, or even death. While infected newborns can be treated with a viral medication after birth, many can still suffer from the negative defects as a result of this infection. So clearly important for these babies to be born via cesarean. So the other one is human HIV. Human immunodeficiency virus, also known as HIV, can be transmitted from pregnant person to their baby during labor and birth. And this is referred to as vertical transmission. In the past, it was recommended that all individuals with HIV deliver via cesarean. And in some areas, this may still be the preference for their OB care. Research has indicated that with the use of antiretroviral medications, also known as ZDV, during pregnancy, birth, and vaginal may be an option for some moms. All right, moving on. So severe hypertension. If you have experienced hypertension at all, you can sometimes be more apt to have this during your pregnancy. Some women don't have a problem with this and it doesn't get too out of control and don't have a problem with vaginal delivery, while others may have severe spikes in their blood pressure that would cause them. So the mild to moderate sometimes have an induction of labor and vaginal delivery may be a preferable option. Those, of course, with severe, usually the best course is a cesarean. According to American Congress of Obstetricians and Gynecologists, severe preeclampsia is defined as blood pressure of 160/110 or greater on 2 occasions, 4 hours apart while resting. Also pulmonary edema or excess fluid that develops in the lungs, pulmonary meaning lungs. Severe upper right abdominal pain, cerebral or visual disturbances, increased liver and kidney enzymes, low platelets. Those with severe preeclampsia are typically managed on an inpatient basis and monitored closely for those changes in the symptoms. Providers may not need to see all of the above symptoms in order to recommend an immediate delivery. And for some, the determination may be made on how rapidly the symptoms are developing, if they come on really quickly. When possible, induction of labor in the anticipation of a vaginal birth is often preferred. However, gestational age, severity of symptoms, and the rate of progression of symptoms may lead the provider to feel that immediate delivery by cesarean birth is the best course of action. I will say too that many moms who I've worked with who have had preeclampsia, like mild to moderate, oftentimes those moms will be encouraged to induce early to avoid getting into a later stage. And if you are concerned about that, definitely ask your provider what their course of action and policy is regarding that. And that would really make you feel a lot better in understanding that. So fetal position. This is one optimal position for vaginal, of course, is with baby head down. That's also known as vertex. When the baby is breech, their feet or bottoms will be born first. This can pose an increased risk to the baby. The cord could prolapse or drop down in front of the baby's head and be pinched off. But this is difficult to experience, just that understanding of having that baby's head. One of the other factors here is a lot of our obstetricians and midwives are not trained in delivering breech. And when you don't have that training, it's really hard to feel comfortable navigating that. And the safest route is to do the cesarean. All right. With fetal positioning, some providers do feel comfortable with what's called external lactic, I can't pronounce that, version. This procedure is where the provider tries to turn the baby into a head down position using their hands to rotate baby from the outside. This can be quite painful for moms. They do offer sedatives and different things to help mom if this procedure is recommended. Another fetal position that is required a cesarean is called transverse presentation, and that is when the baby's head is lying on one side of the pregnant person's abdomen with the feet on the other. So crossways, kind of. A good visual would be to picture the baby lying in a hammock, with each end of the hammock at the pregnant person's hips on each side. And when a baby is in this position, there is a really great risk of that cord prolapsing if the water breaks. Some providers may try to locate baby from the outside. We already talked about that. So if this is something that you're experiencing, I will say that a lot of parents will be told that their baby is breech. Oftentimes babies do hang out in a breech position in that third trimester, and some of them just turn later than others. So if your baby's not head down, don't freak out. Talk to your provider and talk about your options so you feel a little bit better about that. In some areas, there may be providers who are willing to attempt a vaginal delivery with a breech baby. These are more hard to locate these days because of the training for that. So another reason for cesarean would be a previous cesarean. Their provider may recommend this, and for some, it will be a preference for the mom, depending on what the reason of the previous cesarean is, as well as the state and the pregnancy of this the current pregnancy. All right. Placenta previa. So this is kind of a word that you may have heard knocked around during pregnancy. The placenta, as it attaches to the uterine wall and grows, it oftentimes attaches and then grows north or up towards your head. So the placenta is basically that lifeline between your body and the baby. It implants, of course, and provides your baby with oxygen and other essential nutrients to help with your baby's growth. So it's a really important aspect of your pregnancy and support for your baby. In many cases, it will implant and on the sides or the top. Oftentimes it's higher up, kind of closer to where it would come out of the fallopian tubes up there. But in some pregnancies, the placenta will implant over or close to your cervix. If you find that this happens early on in your pregnancy, oftentimes it does grow up the side of the wall, but on occasions it will grow over the cervix or near the neck of the cervix, the opening, and it can be dangerous to have a vaginal birth with placenta previa. Let me go on. When it does that, it basically blocks the passage and then can cause severe bleeding and poses a huge threat to baby and mom. It does occur in about 1 in 200 pregnancies. And you usually know fairly early on if you have that. So if you ladies are due in March, you're not dealing with that. Cesarean birth after labor has begun. For some individuals, the decision to birth via cesarean may not be made until labor is underway. These are kind of generally identified as unplanned or unscheduled medically indicated cesarean births. And we're going to next take a look at some of the most common reasons that cesarean birth may become necessary once labor has begun. So if you're trying for a natural or vaginal delivery and you end up having a cesarean, we're going to talk about some of those reasons why. Okay, common reasons. So you can see there, mom's in labor. She's got her monitor strapped up here. This top strap here, if those of you who don't know or haven't had babies before, this is called your tocometer. That's going to measure the strength and length of your contractions. Super exciting stuff. And during labor, your provider is going to monitor your baby and your contractions. These vital signs are a big indicator of how each you and your baby are handling the stresses of labor. In some cases, there may be a development during labor that makes vaginal birth just a less favorable option for either you or baby or both. We're going to take a look at those. They're fetal distress, umbilical cord prolapse, uterine rupture, maternal distress, and eclampsia. All right. First is fetal distress. The American College of Obstetrics and Gynecologists identify fetal distress as a non-reassuring fetal heart tones. It is one of the more common reasons that cesarean birth may become necessary during labor.
We can't see anything.
Oh no. Okay, thank you so much for letting me know.
I'm sorry.
No, that's totally fine. I'm glad that you stopped me. All right, let me get out of here. I wonder if something happened with our screen sharing. Okay. All right, I'm going to put it back on non-share. Let's see. I'm going to put it off of that. Okay, now, when did it stop, ladies?
It never started.
It never started. Oh geez. I'm so sorry. Goodness. Okay. So I got this on, but it never started. I must have not hit something. Okay. So you've heard everything, correct? But you haven't seen everything.
Correct.
Okay. So we have two possible options here. We can start over and I can flip through them really quickly. Or I can start from where we're at and just start the slides. What would you guys prefer?
I'm okay with from where you are.
Okay. Yeah, because it's already almost 8:23. Okay, well, let me try this again. There's no content that you're missing. You're just missing the physical images. So let me get that going the right way. Okay. Let's see if I can just do this. I'm going to share the PowerPoint. And some current slide. Okay, can you see now?
Yes.
Okay, thanks. Thanks for stepping forward and sharing with me. So sorry about that. All right, so fetal distress is one of the most common reasons, and basically during labor, your provider is going to be monitoring your baby's heart rate and how they respond to be able to identify if there's any concern with fetal distress. Any intervention such as epidural for pain relief may result in more closely monitoring. So you can see here on this thing, you're going to see the tocometer here at the top, and then this is going to be baby's monitor, so monitoring baby's heart. And they'll constantly do that. If for some reason they don't feel like they're getting good monitoring of these, then they may do what's called internal monitoring, and they can do both internal monitoring for baby and your contractions. So just note those things, especially if they don't feel like they're getting good monitoring and they're just unsure of that. So like we were talking about, those interventions such as breaking your bag of waters, the use of Pitocin to kind of induce or speed up labor or strengthen those contractions. Maybe your contractions are happening, but maybe they're just not strong as your provider would like to see them. And choosing the epidural for pain relief may result in a closer monitoring of you and baby. These interventions may interrupt sort of the flow of oxygen to baby, causing an abnormal heart rate. So anytime you're doing an extra thing or you've changed something, those kind of things can happen. I often see, when you break the bag of waters, baby's got this great, nice cushion. When that water is gone, baby's feeling labor a little bit more intensely. Does that make sense? With Pitocin is a synthetic form of oxytocin, and naturally your body's going to be contracting using oxytocin. Pitocin is dripped in on a really slow rate and increased in very small increments. And while it's increased, they're monitoring to make sure that your baby's handling those labor contractions with the Pitocin really closely. Some things, other causes could include maternal illness, if there is any infection in baby, umbilical cord compression. So if the umbilical cord's in a place where it's getting compressed, which is not adequately nourishing baby like it should, that's another thing. Placental abruption or maternal positioning. So placenta abruption is where the placenta breaks away from the side of the uterus too early. Usually it's born, I call it born, the placenta is born after baby's born. So if that happens, then that can be hazardous to both you and your baby. When reassuring fetal heart tones are not identified, the provider may try to resolve it. So they're going to look at changing your position. They're going to look at like possibly giving you a little bit of oxygen. They may put IV fluids. They may do what's called an amniofusion. So that's where they pump in saline solution into the uterus to kind of give that extra cushion to baby if there's any cord compression or baby may not be handling that labor really well. So call for a cesarean delivery if those heart tones don't change or they last too long to where they're not healthy for mom or baby. All right. And next is umbilical cord prolapse. So we mentioned this a little bit before. When the umbilical cord prolapses could occur before labor, is most likely to occur when the bag of waters breaks, either as labor begins or during the course of labor. So some women have sort of the, I'd call Hollywood bag of waters breaking, where it's this big gush. But a lot of us have what we call like a high break or a small break, and where that bag, that amniotic fluid just slowly trickles out, kind of where you need to wear a pad. It just kind of keeps coming out with those contractions. And some individuals, the labor will start, like I said, with the bag of water breaking. Then for others, bag of water may break during labor. The provider may also break the bag of waters during the course of labors with an amnio hook, which you guys will probably see if you take childbirth ed. You get to see one of those. Those are fun. It kind of looks like a long crochet hook. All right. The umbilical cord prolapse occurs when the bag of waters breaks and the umbilical cord is kind of swept down in front of baby's head. Sometimes this cord can be felt in the vagina because the cord is kind of trapped between the baby's head and the expectant person's pelvis. And this just cuts off oxygen and nutrients to baby. When this happens, it is typically considered an emergency situation. So a cesarean is performed quickly. Depending on the severity of the prolapse, a nurse or other health care worker may place their hands into your vagina and hold baby's head off of the cervix to keep that compression off of the cord. And this allows for better oxygenation, so baby is not getting in distress as much. So that's can happen. In most cases, a prolapsed cord is a true emergency, and in this situation, there may not be time for what we call an epidural or a spinal anesthesia. So a lot of moms who experience an umbilical cord prolapse will be under general anesthesia. So you'll be not conscious. Right. Next, we have uterine rupture. Uterine rupture is a tear in the uterus during labor. The uterus is kind of this big muscle and organ that holds the baby, the amniotic sac, the placenta, and the uterus rupture is most common in those who have a history of previous uterine surgery, such as a cesarean birth. Uterine rupture can also happen when there's no history of uterine surgery or scarring. It is most commonly identified by fetal distress and maternal pain. So a lot of times you can see in this picture, it's just like, just severe pain, and baby goes in distress. So it's really it's kind of sort of a persistent pain, and it can also often be felt even if you have an epidural. So it kind of, instead of coming and going like a contraction, it's just a constant pain. Due to the risk of maternal hemorrhage and lack of oxygen to the baby, uterine rupture requires immediate and most common general anesthesia is used in this. Is not a super common thing. I would have to look up the stats on that, but it is a reason why you could potentially have a cesarean. Maternal distress. So preeclampsia may cause maternal distress during the course of labor. There's different scenarios of this distress in different degrees, but preeclampsia is definitely one of those. In some cases, an induction may be already underway. Like I said, any woman who has high blood pressure, preeclampsia, yes, prenatal kind of preeclampsia, they oftentimes want moms to go before their 40 weeks with an induction. Not always, but preeclampsia is a condition of high blood pressure. Also, they're checking the protein in your urine for that pregnant mom. This condition, of course, can result in induction, and sometimes the condition will worsen during that course of labor. And when those conditions happen, that will be when a cesarean birth is indicated. All right, so consumer choice. Not everyone, I would say probably the majority of women do not want or choose to have cesarean birth, but expecting individuals may prefer that. They may have lots of different choices. We call that consumer choice or cesarean on demand. And there are two main reasons why an individual may choose cesarean over vaginal. These basically include either a preference for cesarean with their first birth or a preference for cesarean after a previous vaginal birth. So I'm going to keep going through this. While it may seem like a natural bodily function for some, others have thought of vaginal birth may cause a lot of fear and anxiety. Some, there may be sort of a personal history that leads them to this choice. For others, there may be more of the ability to control the process and kind of know exactly what to expect. This process may take them to be their primary motivating factor of this is just that control. A history of previous sexual trauma may be another reason that individuals have chosen elective cesarean birth. When traumatic experiences surround the genitals have been a part of an individual's life experience, these sensations of labors can be very triggering for moms. For others, there's a need to control these experiences as much as possible, and overall personality and previous trauma may be the underlying preferences for cesarean birth. Previous or repeat cesarean is also another motivating factor. So those who have had previous cesareans may not have the desire to try for a vaginal birth. Knowing kind of what to expect, lack of a provider support for vaginal birth, or a preference to be able to schedule their baby's birthday for a certain time are often common factors. Each individual brings their own personal history, life experiences, and personal preferences about this decision. All right, we're going to get into the nitty-gritty of how cesarean birth is performed. If I don't answer all of your questions, we'll definitely go over these at the end. So when a cesarean birth is indicated, the timing of the cesarean and or your individual health factors will determine what type of anesthesia can be used. For true medical emergencies, like we spoke of, the cord prolapse or uterine rupture, general anesthesia, which is, you know, a mask over your face, putting you out completely, may be necessary. For other less emergent or scheduled cesarean births, you're going to either have a spinal or epidural anesthesia. The process from start to finish is, I'm going to talk a little bit about that. So an IV is going to be placed to deliver fluids or any necessary, for any necessary medications. So this is very much the same as if you decided you wanted to have an epidural when you were in labor. If you decide you want an epidural, they're going to let the anesthesiologist know, and they're going to immediately put on a bag of IV fluids. So with an epidural, you run the risk of it lowering your blood pressure. So they pump extra fluid into your veins so that that blood pressure drop is not felt by mom, or hopefully not felt by mom. You will also have a bladder catheter that will be placed, and it will be emptied during and after surgery for you. This bladder catheter typically remains in place for about the first 24 hours. Typically, they will also give you an antacid medication. This will help neutralize the acids in your stomach prior to surgery so that you don't feel that and don't throw up. Surgery area will typically be prepped by shaving the area where the incision is placed. So they'll just shave that really quickly. One of your nurses will. And then once you're entering to the operating room, a drape or screen will be placed up right around your chest area once you're positioned on the operating table. So they'll roll you in on a bed, and then they'll shift you from that bed onto the surgical table, and that's where they'll put up the drape. Your abdomen will then be washed with sort of an antiseptic solutions. Typically, you don't feel this as much because once that, well, if you had an epidural placed in the room, you will be numb from kind of your belly down. And you usually don't feel these kind of things. And they'll check with you and say, do you feel that? Do you feel that? No. And you'll let them know how you're feeling with the anesthesia. You will be provided with a test to ensure you have that proper anesthesia before they do any of that, any of the surgery. The incision is then made just above the pubic bone through the skin. And this, most commonly, the incision is horizontal. They're occasionally, in more of an emergency situation, they will have the old style, which is like the T-shaped incision. That could be necessary. But for most non-emergency cesarean births, it's really small and tiny, probably about that long, teeny tiny. Once the uterus is open, the bag of waters will be open and suctioned the amniotic fluid. So they'll take out that. And then it's going to be time for your baby to be born. So from the point where they start this until the baby's born is very fast. So you will, during this time, you will have the support of your partner or support person, doula, whatever, with you. Excuse me. Oh, gotta sneeze. You'll have them with you by your head, and then you'll have a team there in the OR talking to you and checking in with you. Usually the nurse anesthetist and the anesthetist will check in with you a lot. So when it's time for your baby to be born, the baby will be delivered through the incision in the uterus. Breech, your provider may deliver your baby butt first. For babies who are transverse, the provider will move the baby they'll shift baby into a head down or a butt position depending on which works best. And then once your baby is born, the umbilical cord will be clamped and cut. The baby is typically taken to the warmer and given a quick exam by the baby nurse. Usually there's a respiratory therapist. There's usually around 3 nurses. Sometimes the pediatrician will be there, depending on where you deliver. If the baby is stable, and the baby will be brought to you, swaddled up. Partner can usually get baby from the warmer and bring baby over, or the nurses bring them over, and you can have kind of a skin to skin. In this situation, every hospital's policies are different on this. So if you want to have baby on your chest or more skin to skin, you have to talk with your provider to ask what options you have with that. The provider will then deliver the placenta and begin to close the incision layer by layer. So the birth part of your baby is just this really quick snapshot of about 5 to 10 minutes. Then the next part is the longer part. So, and you don't want this to be quick, because it's important that providers have the time that they need to be able to suture you up and get everything back where it needs to be. So the top layer of the skin may be closed with sutures. Usually they're dissolvable these days, but there may be places you're still using staples or specific surgeries depending on your surgery. Once the surgery is complete and the parent is stable, then you will be taken into recovery. So for most, this typically takes around 30 to 45 minutes, with the baby being born in the first 5 to 10. Occasionally it does take longer depending on the situation, but that's kind of an average. After your surgery, you can kind of expect to stay in the hospital for at least 3 to 4 days, when there are no complications. You will be encouraged to kind of get up and walk around and move around after you're mobile, and this helps get that extra air and gas that gets trapped into your abdomen during surgery, and it also serves to prevent any blood clots. Oftentimes they'll have what is called the pumper booties on you to ensure that you get good circulation in your legs. You may have known somebody who's been in surgery who has those as well. Pardon me. The incision site definitely may be tender, so it is recommended that you use pillows when holding or nursing your baby, a lot of support, and just moving a lot more slowly than you would with a vaginal birth. The first weeks of post-cesarean are often like the hardest. During this time, it is best to take it easy, not lift any more than the weight of your baby. If you live in a house with 1 or more levels, set up a changing station downstairs so that you don't have to move up and down stairs multiple times a day. During this time of your recovery, it's also important to remember staying on top of pain. So some of us really don't like to take pain medication, so we want to try to take the least dose that we have, that we need, and still be able to function. And sometimes that will creep up on you, and all of a sudden you're dealing with a whole bunch of pain. So it's always nice to kind of know that in that first week or two that you do need to manage your pain so that you can spend that time and feel comfortable and take care of your baby and take care of yourself. So that's just a really good tip. Let's see. It is important also to be able to take care of your incision site, making sure that it stays dry and clean, and then just following any instructions that your provider might have for you post-operative for that cesarean incision. And then just remember that it's okay to ask for help. So with cesarean birth, it is a surgery, and so your body is going to be healing and be a little bit more tender and just take a longer recovery than you would for most vaginal births. Having a postpartum doula can be a great asset to help you with that post-recovery, just knowing, that support of a knowledgeable and compassionate, skilled person. If you've got somebody in your family who's very comfortable with that and patient, you definitely want to surround yourself with positivity in the postpartum. So if you have somebody who wants to help support you, just make sure that they're going to be in a space of positivity, and that you're going to feel comfortable and not stressed. Great. All right. Anyway. So in the use of this and creating the content for this, I have a lot of sources. There were several sources that were used. One is scheduled cesarean delivery and HIV infection, recommendations for use of antiviral drugs in pregnancy with HIV infection and interventions to reduce perinatal HIV transmission, reasons for cesarean birth, preeclampsia beyond the basics, and placenta previa in the March of Dimes. So I have these listed. If any of those are interest to you, please let me know and I can send you those resource links. Okay. Awesome. So thanks so much for being here tonight and spending time with me. And I do apologize about the screen sharing. I guess I didn't click the right button, right? While the thought of cesarean birth really can be scary for some and comforting for others, it is my hope that you learned kind of to demystify cesarean birth, the what, why, and how of it. And we hope that you feel comfortable moving into your labor and birth experience, understanding what to expect and feeling a little calmer and a little more prepared for that. If you have any particular questions, I'm going to stop the screen share at this point. And I'm going to answer just a couple of questions that one lady was submitted to me in case she views this on the recording. I don't know if that was one of you ladies or not, but I'm going to go ahead and answer those questions. And if you have questions, you can unmute yourself. Let me see if I can unmute. I'll unmute all of you ladies. I think that worked. I don't know that that worked. Okay. Well, try to unmute yourself. Having trouble. Unmute audio. Okay. Can you ladies still hear me? Okay. Yes, awesome, thank you. Okay, so if you have a question, please put that in. Oh, Caitlin, oh great. Friendly and vaginally, awesome. Thanks, Caitlin, for sharing. We are, I just want to share a couple of questions that we had posted to our email. One was what to expect with pain and recovery. And if you ladies want to, I'm going to stop the recording at this point. Oh, actually, I can't stop the recording. If you guys can try to unmute yourself, that would be great. Oh, there you are. Aha. I think I unmuted you. Yes. Seems like it's working, maybe. Okay, awesome. So I unmuted you. If you don't want to talk and you want to mute yourself back on, go ahead. But a couple of questions here that were posted, 4 questions. If you have to have an emergency cesarean, do you usually have time to get an epidural prior? So if it is an emergency, usually the answer is no to that. That usually is a general anesthesia. Very few cesarean births are emergency, so usually they will, if you already have an epidural placed, they're going to put that medication in the epidural pump. If not, they're going to place usually a spinal and get you set up in the OR. How long till you get to be with baby afterwards? So like we said before, that this is usually around an hour, sometimes 45 minutes. So when I talk about having that first bonding period, usually baby's in that window around the first 2 hours of birth. So it's often really wonderful to have to not worry or stress about that if you can't have that bonding in that first hour, because babies are usually wide awake and for the first 2 hours. So I usually see no problem with babies getting to bond. Now, if for some reason your cesarean birth is a little bit more complicated or you're under general anesthesia, then dad can do a lot of skin to skin with baby and connect with them. And then when you're able to be with baby, then you can have that time and still have that skin to skin. The other question proposed was how long till you get the feeling back in your legs from the epidural after a cesarean section. So they will slowly start to feel, depending on what you're, if you were under general or a spinal or a epidural, but typically somewhere around an hour and a half or 2, you'll start feeling more. They like to get you up within like 3 hours just because it helps promote healing and recovery, gets that gas pains moving, make sure your bowels are moving, and just they've seen that the earlier on that you can get up and get moving, it improves the overall recovery of mom. But they're only going to do that with support and making sure everything is going well. Let's see. The other question was what to expect in pain. So with pain, I would say that pretty much varies from mom to mom, but you will expect to be tiered off of your medication. So oftentimes, if you have a spinal, you're gonna have pain medications pumped into that, and then those will last beyond being out of the OR. And then from there, they will probably start tiering that down to less high-powered. So it'll go from your spinal medication to something that's a little stronger, all the way down to ibuprofen. Usually a lot of providers will do Tylenol, ibuprofen as an option there. So it's always a good idea, if you have a question about medications, to talk to your doctor about. As a doula, I'm not a medical provider. I just have the experience of being with women who have been through cesarean birth, and kind of from my knowledge of that. But you always want to double check with your provider to see what their recommendations are and what they generally do. It's always a good idea to ask that. Any other particular questions? Okay, so how does pain medication affect safety with breastfeeding initially? So Whitney asked that. That's a great question. So in most hospitals, they know that moms want to breastfeed. So they're not going to give you, they're going to give you the least amount of any medications or narcotics so that you can breastfeed and stay alert and awake, because they know that you want to bond with your baby and be there and be able to function and participate as a new mom, just loving on your baby. So narcotics usually do pass the blood-brain barrier, but they're not, they're going to give you the ones that are most apt to have less effects. But I don't know the particular medications that they would prescribe, so you have to ask them. That could vary from doctor to doctor, and then from anesthesiologist to anesthesiologist, because your OB provider and your anesthesiologist will kind of be working in together to help manage that for cesarean birth. Let's see, I also did want to talk about pain and recovery, so what to expect. I feel like a lot of women want to know more about, like, what am I going to be able to do? So with cesarean birth, you really you aren't able to do a lot. You can't drive. You can't lift things.
Oh, you just have the door open.
You're not like going up and down stairs. Can also have those real pulling effects on that incision. So you really want to take it easy. Whether you've had a cesarean birth or a vaginal birth, you're gonna want to take things slow, but you're still, with both of those, you're gonna want to move around. But with cesarean, you definitely aren't able to drive and aren't able to lift. Yeah. Oh, Caitlin said, I've heard great things about spinning babies from other moms for exercises to new babies. Oh, that's great.
Right now. Okay.
So Jessica had a question. In the case of the baby that is not in the right position, is there anything that you can do? So spinning babies, thanks for that resource, Caitlin. I often tell moms, like, don't stress about your baby's position, because they will often move later in pregnancy. I've had several moms who've had breech babies, and they did either do external version, or they went and had one lady drive down to Atlanta to a doctor. His name was Dr. Boots Taylor, and he just does breech birth. And she had her baby down there because she was a product of a breech birth, as well as her husband, and they had a just really strong desire to make sure that their baby was born however it was supposed to be born, and that breech birth was just considered normal for them because of their personal experience with that. So Spinning Babies is a good resource. I would talk with your provider and see what they think about that. You know, there's lots of old wives' tales about moving baby into right positions. Anything from dad singing down there to get baby to turn around, to laying on an ironing board and all kinds of stuff. So your doctor will be able to help you with that, and or your doula talk to you more about that. So any other questions? Let's see. Awesome. So it is almost 9 o'clock. I really appreciate you guys connecting in here and sharing. And if you have any other questions about cesarean birth in particular, or just about pregnancy and birth, definitely check out our website. We will have lots of classes coming up. So if you're in either the Tri-Cities or the Boone area, check out those upcoming classes, and hopefully I'll get to meet you guys if I haven't already met you in person. So thanks so much again, and we will send out the PowerPoint to you guys so that you can see the entire thing, since I failed to post it all the way up there and share it the right way. All right. Yes, Amanda, we will be sending it out to you. So I will send out the recording, and I'll send out the PowerPoint for you ladies. Thanks so much for being here tonight, and everybody have a wonderful evening. If anybody has any questions, I'll stay on for just a little bit and answer those if you want me to. Yay.